Supplements and vitamins to heal and repair your kidneys naturally. The kidneys are vital organs responsible for filtering waste, balancing electrolytes, regulating blood pressure, and producing hormones. When the kidneys are damaged due to chronic kidney disease, diabetes, high blood pressure, infections, or other conditions, their function can decline, leading to serious health complications. While medical treatment and lifestyle changes are essential in managing kidney disease, nutrition plays a critical role in kidney repair and maintenance. Certain vitamins, minerals, and nutrients support kidney function by reducing inflammation, preventing oxidative stress, and promoting detoxification. By providing essential nutrients, some supplements can enhance kidney function and reduce the risk of nutritional deficiencies. In this video we will explore the most important nutrients or supplements that help repair and support the kidneys. Understanding the benefits and risks of using supplements for kidney health is key to making informed decisions. Here's what to know about the supplements that might be best for supporting your kidneys. 1. Vitamin D. Vitamin D plays a crucial role in kidney function and overall health. The kidneys help convert vitamin D into its active form, which is necessary for calcium absorption and bone health. When kidney function declines, the body's ability to activate vitamin D decreases, leading to weak bones and an increased risk of fractures. Beyond bone health, vitamin D also has anti-inflammatory properties that may help reduce kidney inflammation. Chronic inflammation contributes to kidney disease progression, and maintaining adequate vitamin D levels may slow down this process. Supplementing with vitamin D can help manage bone disorders and prevent cardiovascular complications. Foods rich in vitamin D also include fatty fish, salmon, mackerel, sardines, egg yolks, and fortified dairy products. Sun exposure is also a natural way to boost vitamin D levels. 2. Iron. Iron is necessary for the production of hemoglobin, which carries oxygen throughout the body. Individuals with kidney disease often develop iron deficiency anemia due to reduced erythropoietin production. Symptoms of iron deficiency include fatigue, shortness of breath, and weakness, all of which can worsen kidney function. Iron supplements typically come in the form of a pill. However, some people may have the iron injected into a vein. This includes people receiving dialysis, a treatment that filters waste and water from your blood if your kidneys no longer can. Iron-rich foods also include lean red meat, poultry, fish, lentils, and fortified cereals. 3. Omega-3 fatty acids. Omega-3 fatty acids, found in fatty fish like salmon, mackerel, and sardines, are powerful anti-inflammatory nutrients. Chronic inflammation is a major contributor to kidney disease progression, and omega-3s help reduce inflammation in the kidneys and blood vessels. In addition to their anti-inflammatory effects, omega-3s also support heart health by lowering triglycerides and reducing blood pressure, two critical factors in kidney disease management. For those who don't consume enough fish, plant-based sources of omega-3s include flax seeds, chia seeds, and walnuts. Fish oil supplements may also be beneficial, but individuals with kidney disease should consult their doctor before taking them. 4. Magnesium. Magnesium is crucial for muscle and nerve function and cardiovascular health. Due to dietary restrictions and medication interactions, magnesium deficiency is common in people with kidney disease. That means supplementing with magnesium may help you prevent the mineral deficiency. Lower magnesium levels have been linked to a progression to end-stage kidney disease, which is the last stage of kidney disease when the organs can no longer perform their duties. So making sure your magnesium levels are normal through supplementation can potentially prevent or delay disease progression. Even people without kidney disease can benefit from supplementing with magnesium. Lower magnesium levels are associated with an increased risk of chronic kidney disease, so taking in the proper amount of magnesium can help avoid the development of kidney disease. Good dietary sources of magnesium include leafy greens, nuts, seeds, whole grains, and avocados. However, individuals with advanced kidney disease should consult their doctor before taking magnesium supplements. 5. Probiotics. Probiotics, the beneficial bacteria that reside in the gut, play a significant role in supporting kidney health. They help maintain a balanced gut microbiome, which is crucial for overall health and immune function. For people with kidney disease, probiotics can be particularly beneficial. They aid in reducing uremic toxins, which are substances that accumulate in the blood when the kidneys aren't functioning properly. Additionally, probiotics can help reduce inflammation and oxidative stress, which are common issues in chronic kidney disease. Probiotic foods include fermented foods like yogurt, sauerkraut, kimchi, and miso, as well as some cheeses. 6. Vitamin C. Vitamin C is a powerful antioxidant that supports immune function, collagen production, and tissue repair. For kidney health, the vitamin's antioxidant properties are particularly valuable, as they help neutralize free radicals and reduce oxidative stress, a contributing factor to kidney damage. Just make sure to consult with your healthcare provider about how much of the supplement to take. While moderate supplementation may be beneficial, high doses of vitamin C can lead to a buildup of oxalate, a natural substance in many foods, that can cause kidney stones. Among people with kidney disease, oxalate buildup can also result in oxalate deposits in bones and soft tissues, causing pain and other complications over time. Fruits and vegetables like bell peppers, oranges, strawberries, and broccoli are excellent sources of vitamin C and can be safely consumed in moderate amounts. 7. Zinc. Zinc is an essential trace mineral that supports immune function, wound healing, and cellular repair. The kidneys play a role in filtering zinc, and individuals with kidney disease often have lower zinc levels due to increased loss through urine. Zinc deficiency can impair immune function, making individuals more susceptible to infections, which can further damage the kidneys. It also plays a role in reducing oxidative stress, which is a key factor in kidney disease progression. Foods rich in zinc include oysters, beef, pumpkin seeds, chickpeas, and whole grains. While supplementation may be necessary for some individuals with kidney disease, excessive zinc intake can lead to imbalances in other minerals like copper, so it should be taken under medical supervision. 8. B vitamins. B vitamins, particularly B6, B12, and folic acid, play a role in energy production. Not getting enough of the vitamins can lead to anemia. Kidney disease can lead to B vitamin deficiencies due to impaired kidney function and dietary restrictions. Supplementing with B vitamins can help prevent the deficiencies and the anemia they can cause. The kidneys play a vital role in maintaining overall health, and supporting their function through proper nutrition is essential, especially for those at risk of kidney disease. Key vitamins and minerals such as vitamin D, B12, magnesium, omega-3 fatty acids, zinc, vitamin C, and iron all contribute to kidney repair and protection. However, individuals with kidney disease should be cautious about certain nutrients, especially potassium, phosphorus, and excess protein intake, as these can place additional strain on the kidneys. A well-balanced diet rich in kidney-friendly nutrients, combined with medical guidance, can help slow kidney disease progression and improve overall kidney health. If you suspect kidney issues, consult a healthcare provider before making significant dietary changes or taking supplements. If you found this helpful, give this video a thumbs up, subscribe for more health tips, and drop a comment below with your favorite kidney-friendly foods. Stay healthy, and I'll see you in the next video.